I want to welcome you. I am Curran Carvalho, the Interim Dean of Social Work here at the University of St. Thomas and at St. Catherine's University. We are so pleased to be involved in this really important coalition, this really important coordinated effort that's been going on for about a year now. In that work, I want to publicly thank Catherine Hill for her leadership at the university on getting St. Thomas and St. Catherine's involved in this, involved in this important effort. Just a couple of quick logistics. There are bathrooms by the, if you go towards the elevator before you get there, if you turn right and turn left, that's where the restrooms are. If you find you need something to eat or something to snack on, if you go to the bottom floor, there is a store down there, and there's also a little cafeteria, so feel free to use those as well. We have coffee, tea, and water in the back. They are asking for donations to help offset the cost of that from, I think it's elders. Thank you. So with that said, again, welcome. And so I'm going to turn it over to Representative Pinto.
Hello, so I'm State Representative Dave Pinto. I represent the district that includes St. Thomas, Highland Park, McAllister, Groveland area, so welcome to those not from this area. I'm also the co-founder of this series of Prenatal to 3 policy forums. If you look on the back of your agenda, you'll see, I think, a nice description of why we are here and what is going on. I co-founded this work with the group called Elders for Infants, which is an amazing group of in many cases, retired professionals, but they're not retired from the work. They're working incredibly hard. So this is the 5th of these Prenatal to 3 policy forums. And as you'll see in the back, our purpose is really threefold. To spread information about and have a shared base of information about what it is that we're trying to accomplish in this work, to have plans be shared among different coalitions, and then also to build a shared sense of community and common interest. So this particular forum, the timing of it is particularly important. As you'll see in the agenda, the first half of the agenda is we're going to hear about what happened in the 2017 legislative session, in particular, where we at, and kind of bringing us up to today. And then the second part is, as we've done each of the 5 previous forums, is to hear from the coalitions working on early childhood. That includes a number of groups, as you'll see on there, and to kind of talking about, okay, well, what are we working on now, and where are we going with things? And that first half, the recap, is going to be mostly delivered by the Children's Defense Fund, talking about what happened in a number of different areas. But then we've got several presenters with particular expertise talking about some particular areas, and we'll get to that as we go. Since the last forum, you'll note we now have a website, p3minnesota.org. If you look at it, it's in black and white, it's bare bones, but it gets the job done. And the reason for that is because, as the dean said, there's no particular budget for this. This is all volunteers and people working on it. And so if you're able to make a contribution to help with refreshments, et cetera, we very much appreciate it. I am so excited to have all of us back together again and to continue this work on behalf of kids in Minnesota. I'm especially excited to be joined as the co-host for this particular forum by Senator Jerry Ralph, who's in his first term in Minnesota Senate from St. Cloud. He himself is not only welcoming us and serving as a co-host here, but you're actually going to be hearing from him and some of the work that he's been doing in the Senate. So please join me in thanking and welcoming Senator Ralph, who will keep us moving in the process here. Thank you.
Well, thank you. Thank you for having me here. I'm real excited about this. This is obviously my first time with this group, and as a freshman legislator, kind of a first time in a lot of stuff. So I'm just actually really excited. I'll talk later on about some of the things in more detail that we did, and I serve on both the Aging and Long-Term Care Committee, which I'm a vice chair, and I also serve on the Human Services Reform Committee. And it is that committee that I'll be focusing on in terms of the work that was done this past session and what we hope to look forward to doing as we go forward. Without further ado, I'd like at this point to just turn it over to Jane Kretzmann, and we'll be looking forward to visiting with you.
Thank you, Senator Ralph. It's my pleasure to welcome you on behalf of Elders for Infants. We're just a little informal group of people, and happy to get to work with a great team that's multi-generational. That's the best and most exciting part of this for me. So now I want to we'll begin our program today. We have, as Representative Pinto has said, we're going to be looking back, and so we're going to be hearing from people about what happened. And our first speaker is Barty Wahi from the Children's Defense Fund. Is Barty, there you are, okay. I haven't met you before, so.
Thank you so much. It is an honor to be here and to present today. Just a quick technical question. If we need to advance the slides, how might we do that? There it is. Push there. Thank you. I'm actually going to call up Jessica Anderson, who is the Children's Defense Fund Legislative Affairs person, because I didn't want to be the only one standing up here for approximately 40 minutes. So she is going to be my partner in crime today as we provide an update of the session. So here we are. And so I think one of the things that we wanted to do was provide just a brief overview of the legislative session itself. There are many advocates that are in this room today that worked very hard to really ensure that children in our state, particularly our smallest little babies, have the best opportunity they can. And I also invite folks, if there are moments where you can provide additional clarity to the rest of the group, please feel free to jump in. But Jessica and I will do our best to sort of provide an overview of the legislative session. First of all, I wanted to sort of just kind of lay the context for some of the slides that you're going to see, because we are going to go a little bit into the weeds. I know many of you in the room and you live in the weedy area, so we're all going to be policy wonks and weed sitters together. But this legislative session, we were looking at a $46 billion biennial budget, which is an enormous number for the state to really come together and make some decisions around. There was a nearly $650 million tax cut package in fiscal year 18-19 that jumps to $791 million in fiscal year 2021. And I only sort of referenced that tax cut because I do think that that set the context for what did happen at our legislative session and what did not happen. So particularly in the areas of education, health, and human services as they pertain to children. So that is the context in which we were operating in. And this year, we had approximately a $463 million cut to the HHS budget based on spending projections. So again, for many of us who do this work, we knew that we were looking at what was essentially a negative target in health and human services. And again, that impacted what we were able to get accomplished this legislative session and what we were not able to get accomplished. So we're going to jump in one of the areas that many of you were focused on, and that is in childcare.
All right, thank you, Barty, and welcome everyone. Thank you for having us here today. So I'm going to talk a little bit about childcare before handing it back over to Barty. If, again, as Barty said, if there's anything we have missed or accidentally overlooked, please raise your hand if there's been a major oversight, but I'll try to do my best to give you an overview of these things. So starting with licensing, regulations, and workforce in the childcare arena, probably the single most important thing that was done was the Childcare and Development Block Grant Health, Safety, and Licensing requirements. This is something required under, sure. Okay. So these were policy changes required under the new federal reauthorization. And these include things like annual licensing inspections, background studies, health and safety requirements around emergency preparedness, child allergies, handling of medications, increased frequency of CPR trainings, and so on. There are also new training standards for licensors and inspectors, and the online public posting of inspection reports of childcare providers. All of these requirements passed at a lower funding level than was requested, but evidently it is sufficient. In addition, there are new requirements around training as it pertains to child learning, and it now must include learning as it pertains to a child's family, culture, and community. Another big thing that happened was the Fixit Ticket. As some of you might be familiar with this, I believe this proposal first came forward in the House. And this is something that can be issued in lieu of a correction order. So if there is a violation that does not present an imminent danger to a child or the rights of a family, an inspector can issue a Fixit Ticket and have the correction or have the violation immediately fixed, and then it won't be posted to that website that I referenced. Next, local grants to increase the supply of quality childcare providers. We'll be talking about this a little bit later too. It's kind of a community-based solution. And so what this means is that entities in many communities across the state can apply for a grant to increase the supply of providers. And there are a bunch of rules or requirements that must be met, but basically these are funds that can be used to fund business startups, training, facility improvements, and so on. And then lastly, DHS will now be required in 2018 and 2019 to publish a child care report, on a variety of indicators. Is there anything major that I missed in that area? Okay. So here's another fun list. Child Care Assistance Program changes. Just as there were health and safety and licensing changes required under the Child Care and Development Block Grant, there are also what some of us advocates think of as the family-friendly provisions. And these were introduced, not all of them passed, as you can see. One of the big pieces that did pass that a number of us are excited about, I'm trying not to editorialize, but is 12-month continuous eligibility. Most of the provisions that allow for that did pass. And so basically what that means is that for most families on child care assistance, they will have fewer disruptions in their lives. There will be fewer disruptions in the businesses of providers because families will be able to maintain their enrollment for 12 months instead of 6. A number of provisions, however, did not pass, including policy changes that would have benefited homeless families, expedited application for these families and certain exemptions, allowing greater job search capabilities at application, changes around eligibility age, untying a parent's work hours from their child care schedule, eliminating certain overpayments, and a big one would be the provider rate increase. A lot of folks have been fighting to increase the provider reimbursement rate for CCAP. Not only did that not happen, but what was required under the block grant was at least using an updated child care market rate survey. Currently, I believe we use the 2011 survey. I'm looking for Claire Sanford to nod in agreement. Yes. So it's very outdated, and that also did not pass. There was one small change around rates, and that was in the St. Cloud area. Now providers who are located in more than one county in the Tri-County area, they can receive the greater of the rates if one county had a greater rate, if that makes sense. So some more child care program changes. There were some savings. Where am I at? Yes, program integrity. So there were some savings generated as well that were reinvested in the program that the administration put forward, particularly around the use of multiple providers. So this was a provision where they're trying to limit the number of families who use more than one provider, and savings are generated through that, and by limiting the number of children of center employees that can receive CCAP. Previously, it was a percentage. It could be no more than 50% of children at a center could be center employees and receiving CCAP, and now it's changed to a number, 25. As you can see, and I won't go into detail on all of these, there were a few others that didn't pass. Penalties around fraud, clarification of overpayments, due process, and so on. And then this next one is very important. Anyone who follows childcare or HHS and was looking at the budget might have been alarmed to see this what looked like an $18 million cut to CCAP. And as I told Barty, this might be kind of a shoulder shrugging moment, but it appears to us that this is mostly an accounting mechanism and that this is being backfilled by another special fund that does not appear on the HHS tracking spreadsheet. So for anyone who's in the weeds and looks at those spreadsheets, apparently this is an accounting mechanism and won't actually affect families. And then lastly, there were proposals, of course, around funding to serve more families that didn't end up going forward. Oh, your turn. All right, I'll turn it back over to Barty.
All right, we'll switch it up. I also wanted to just add a little bit of context. Many of you know that the legislature had a task force on childcare that was meeting during the interim period of session. And it is gratifying to see some things that were many of you testified on and brought to that committee reflected in some of the things that passed. It is also, we acknowledge, disheartening to see that many of the things that we also brought to that committee were not moved on. And I guess that just leaves us the opportunity to look at next year. But I wanted to acknowledge that legislative committee has been talking about many of these issues for quite some time. The next set of legislation that we wanted to talk about was sort of what was proposed and then what actually sort of moved forward was around Head Start and early Head Start, as they play a critical role, particularly for low-income children, children of color, and American Indian children. And this year, no legislation was proposed that would increase funding to Head Start or early Head Start. A proposal to eliminate Pathway 2 Early Learning Scholarship, which I will get back to, was introduced that would affect Head Start. It didn't pass, however, and instead there will be a cap on Pathway 2 that would limit funding to no more than the granted amount for fiscal year 2017, which will impact our Head Start providers. The proposals that did pass to issue local grants to increase the supply of quality childcare. Again, one of the issues that did come up in the task force is the shortage of childcare providers that continues to grow, certainly here, but also particularly in greater Minnesota. The proposal to issue local grants to increase that supply will benefit Head Start and early Head Start, so we were gratified to see that. And so the next sort of funding pool, if you will, for early childhood is early learning scholarships. And so I know that we're venturing into the realm of potentially 4-year-olds here, and I apologize, but we couldn't really decouple these programs and strategies. There was a proposal to expand early learning scholarship to fund all 3 or 4-year-olds eligible and their younger siblings, which is where I think we can certainly be happy, and open the program to high-risk children from birth to 3. What passed was a $20 million investment in each of the 2 biennia to prioritize high-risk children and open the program from birth to 3-year-olds meeting this high-risk criteria. So we're really excited about this increased investment in early learning scholarship, and then also the acknowledgement that children 0 to 3 can benefit, particularly those who are at highest risk for the scholarship. Again, referencing the proposal, there was a proposal to eliminate Pathway 2 scholarships. That did not pass, but a cap was put in place. And then finally, a proposal was put forward and passed that pushed back the requirement that providers accepting scholarship be only 3- and 4-star rated parent-aware programs to 2020. Early learning scholarship has been tied to our parent-aware quality rating system, and we know that as the state continues to ramp up and move forward with providers, the state wanted to make that to continue to make the scholarship opportunity as people work towards that quality goal. It's you.
We did this switch back and forth mostly because I figured that at least the motion of us moving back and forth would keep everyone awake, if nothing else. So as Barty said, it's hard to decouple the 3-year-olds from the 4-year-olds. So we're going ahead, we're gonna throw this in there. School readiness and VPK, why not? And there were proposals both to expand voluntary pre-K and to eliminate voluntary pre-K. What ended up happening, my understanding, correct me if I'm wrong, is that VPK was maintained. However, there was a policy put into place that new sites may not use funds to supplant existing pre-K spending. School Readiness was maintained, and School Readiness Plus was added, which I believe is intended to be targeted to high-risk 4-year-olds, and charter schools can be included, I think. The other policy piece that passed were participation caps for VPK and School Readiness. So as you can see, they exist in 18 and 19 for both VPK and School Readiness Plus. Because School Readiness Plus is currently only funded for 2 years, then FY20 and beyond, you see just the VPK participation cap. Is this you or me? It's you.
This one is easy. No legislation was put forward around early childhood screening, although a considerable need may be necessary. And so because of that, there was nothing passed. Oh, it's me again. One of the pieces of legislation that was put forward was a early education access fund that would contribute, that would coordinate Pathway 1 and 2 early learning scholarship, Head Start, School Readiness, voluntary pre-K, and I think with an idea around CCAP. I think the sort of underpinnings of this bill is, as we've run through this slide, these groups of slides, you can see that there are a number of different funding mechanisms and program models that support young children, right? As opposed to our K-12 budget and our schools, typically that's a pretty sort of, at least for the most part, clear pathway. Here, we do not really, in early childhood, because we have a number of different mechanisms, I think this proposal was put in place in order to sort of get a better sense of sort of how all of these programs work together, and maybe ultimately thinking through what kinds of efficiencies could be created. That particular piece of legislation didn't move forward. However, what we do know is that the Office of the Legislative Auditor will be completing an evaluation of sort of all of these programs and sort of looking at the intersection of them by February of 2018. And we'll be issuing a report, actually, I think tomorrow. I think they have sent some initial information out based on some of the early work that they've done, and you will probably likely be seeing more information as they continue to move forward. We just wanted to highlight a couple of community-based solutions. So there was a proposal to put together a community solutions fund for healthy child development that would have been housed in the Department of Health. It would have really been an opportunity to create an opportunity for communities, particularly communities of color, to identify early childhood indicators and outcomes of well-being that they see are vital, and then really source the solutions that they want to put forward in order to make that happen. Unfortunately, that bill, that piece of legislation did not get a hearing. And then again, another way to think about this is, again, the local grants to increase the supply of quality childcare were really about local community and local providers identifying those needs that they have, and that did pass to about the tune of $519,000. Am I housing? Oh, I'm still housing. I'm sorry. Okay, so a lot of the legislation that we've talked about so far have been really very specifically focused on children and early childhood. We did feel that we needed to sort of talk about some of the other pieces of legislation that impact child well-being, but are not specifically focused on kids. And we wanted to talk a little bit specifically about housing. And so what was proposed this year was the Homework Starts at Home legislation with a request of $8 to $10 million. This program would provide rental assistance to homeless or highly mobile families with school-age children, which we can expect there may have been younger ones that were in those families as well. What did pass was $2 million in fiscal year 18. And then I think what we also saw was $90 million in housing infrastructure bonds were proposed to fund construction of permanent and supportive housing was requested. $55 million was passed, and while it wasn't targeting families specifically, we expect families and children to benefit from that. And we wanted to put housing in here because we know that when kiddos have stable housing, they do better. We also wanted to talk a little bit about some of the measures around economic stability for children and families, because again, we know when kids live in economically stable homes, they also have better health and educational outcomes and development outcomes. And so this legislative session, a $100 increase to the Minnesota Family Investment Program, or MFIP program, cash grant, was brought forward this year and was later then amended to a $13 increase. It was included in the Health and Human Services Omnibus, but no increase was included in the final version of the bills. We also highlight this because there hasn't been an increase to the MFIP cash grant since 1986. Yep. Sorry, that was my editorial comment. Sorry. And so that was, there was some bipartisan support for that cash grant increase, and so I think that was gratifying to see. We would like to sort of see that move forward in the next legislative session as it has been languishing for 31 years. Again, that was my editorial comment. Sorry. And then one provision that did pass was MFIP families that include a new spouse will have the new spouse's income disregarded for 12 calendar months, provided to combine incomes that would be below 275% the federal poverty guideline. That piece of legislation was really about encouraging families to configure as they wish without facing an economic consequence of that particular configuration. Now it's
Okay. This is another easy slide. Paid family and medical leave. There were a couple of proposals introduced for the third year in a row. We had a state-administered paid family and medical leave insurance program come forward. Last year, as some folks may recall, it did pass the Senate as part of its tax bill in kind of a revised form, but then didn't cross the finish line. It didn't receive any hearings this year. However, there were hearings on some alternate proposals around a parental leave tax credit for certain employers and employees, and voluntary employer-sponsored family leave savings accounts. Oh, and nothing passed. Working family credit. So we'll talk about two tax credits. The working family credit is one of them. This was really billed as the centerpiece of Governor Dayton's tax bill. And what it would have done, if passed in its original form, is it would have granted the maximum tax credit to more filers, raised the threshold at which families could qualify, and lower the eligibility age for workers without dependents from 25 to 21. There was a proposal that moved forward, or I believe originated in the Senate, that also would remove barriers for Native Americans who are claiming the credit. Right now, Native Americans living on reservations, working on reservations, cannot claim those earnings for the credit. So in terms of what ended up passing, there were just two of these pieces that passed. The eligibility age for those without dependents has been lowered from 25 to 21, and this provision surrounding Native Americans being able to claim the credit for their on-reservation earnings passed as well. Child and dependent care tax credit is the other tax credit, and I believe our final slide before we'll turn it over. So there were a couple of proposals around this tax credit. This is for families who have child or dependent care expenses. For example, childcare. And there were proposals from Governor Dayton, and Representative Loon has really been a champion on this as well. And their proposals, the only way they differed was in the eligibility threshold. So both of them agreed that the credit should go up to $1,050 from $720 for families with just one dependent, and to $2,100 up from $1,440 for families with two or more. And again, as I said, they differed then in where it should cut off. So right now, the maximum household income you can have to claim this credit is $39,400. Dayton proposed bringing it up to $89,000 for families with one dependent, $101 for two or more. Representative Loon, as you can see, $82 and $94 respectively. So where did they end up? This did end up passing in a form. The tax credit will go up in amount that families can claim. And the adjusted gross income will now be $62,000 for one dependent and $74,000 for two or more, which of course is a pretty big jump up from $39,400. So this will be available to more families, which is a good thing. And I think, let's just make sure. Yep, that was the end of it. So are there any questions for us? Anything that needs to be clarified or? No? Oh, should I not be doing Q&A? Okay.
We're doing a quick debate here that we thought we'd hear from a few more people and then save the Q&A for the end, but you are ahead of schedule, so that's lovely.
Fantastic.
And then we'll do a walking mic. So thank you. That was very helpful. All right. It looks like it's Sue Abderholden's turn to come on down, as we say. Sue has been a long time, and I will call you a perennial because you're still bloomed. But as far as being so helpful in the state, so thank you.
Thank you. Well, good morning. So not a lot happened, frankly, when we talk about mental health, especially for little kids and their parents. We like to say that we don't have a broken mental health system. We're still building it, thanks to the discrimination under a number of different policies, including private insurance, Medicaid, and, of course, Medicare. But we did get our bill introduced that we're calling our macro bill, so I know all you social workers out there will love that term. And it's Mothers and Children Recovery Options. So we did get it introduced. You can see the authors there. We did not get a hearing on it, and I'm going to talk more about what's in it when we talk about the 2018 session. But one tiny thing that we did get in there is a mental health professional can provide basically up to 3 therapy sessions for certain types of individuals. They can do a brief diagnostic assessment, but not the full-blown one. It could be used for a child who's been exposed to trauma. They don't necessarily need a whole lot of visits if you catch it right away. It could include someone who's being seen in primary care, so perhaps a new mother who is experiencing some depression. She could be seen right away instead of kind of waiting. We also think it's important for culturally diverse communities, so some refugee communities, you need to really establish that relationship to be able to help that mom or that child and that family, and you can't ask all those questions right away. And so this would allow that relationship to take place. So we're kind of excited that at least we got that little piece in there. Another thing is that we were looking at, frankly, some of our children's mental health system falling apart. The federal government any day now is going to come in and tell us that we can no longer use Medicaid for any of our residential treatment facilities. So what will happen, and thanks to the legislature, they did actually backfill that amount, so they're kind of paying the federal share for the next 2 years. And so while we're doing that, we want to actually look at our entire children's mental health system. And if I have anything to do with it, it'll actually go down to birth. Where's Catherine? It won't just start at age 5. When we look at our children's mental health system, we have to look at it for all the kids. So what we'll do is really put together a comprehensive assessment. What do we have? Where is it across the state? What is that kind of continuum of care for children? We know, for example, that we do not have kind of a more intensive in-home services for children. You know, we kind of need children's therapeutic services and support, CTSS on steroids, doing something much more intensive to families and getting private insurance to pay for it as well. So they'll be coming back with those recommendations. I do want to say that Minnesota this summer was awarded a Systems of Care grant from the federal government, $12 million, again, to look at our children's mental health system, figure out what we need, kind of close those gaps. So I think that is a very positive step as well. One thing that I did not put on there is we have, of course, every year fought for more funding for school-linked mental health grants. We were not successful in getting more money this year, but we were able to address an issue that last fall I did a 40-city tour of Minnesota, and one of the things, and I wasn't running for office, one of the things that, that I found, especially in rural Minnesota, is they said, and included for little kids, is that because you couldn't use those funds to pay for transportation, they had no way of helping those children during the summer months. And so we added a clause in there that those grant dollars can actually be used for transportation when school is not in session. And so that should be able to, you know, make sure that kids get the treatment that they need. And that's it.
Laura Lacroix Delahun from the Home Visiting Coalition.
Good morning. So I believe I'm playing cleanup here. I actually am excited about all of the things that happened this session related to home visiting. We've been laying the groundwork for the last several years, and I think the advocates who have been working on these issues feel really good about what was accomplished and think we have a great start. Lift the mic. Okay, sorry about that. So I am going to tell you a little bit about the funding that was made available, and also try to touch on some of the proposals that didn't go forward, similar to my colleagues. So what did pass is some new funding for home visiting. It will go through the Department of Health. It is $12 million in fiscal year 18-19, and then it jumps up to $33 million in fiscal year 2021. So the funding is really focused on providing or supporting evidence-based programs, and there are about 12 to 15 different evidence-based programs that have been acknowledged and identified by the federal government. So that's the list that we will be working off of in Minnesota. It is also can be used for startup. So if you are running an evidence-informed program and you want to move towards an evidence-based program, you have the opportunity to do that as well. And then eligible entities, for the first time, nonprofits are eligible through the Department of Health to access or to apply for these types of resources. So we're excited to add them to the list of eligible entities. And of course, our local public health departments and our tribal health departments will remain as eligible entities. Additionally, we were able to see an increase in funding of the MA reimbursement rate for public health nurse home visits. So we know that, you may know, public health nurses do a lot of home visiting. We also have other professionals doing home visits, such as social workers, community health workers. But the public health nurse visits are eligible for MA reimbursement. And the reimbursement rate was far below the cost of providing services. And so we were always trying to supplement resources to pay for this. So we were able to secure resources to cover some of these costs in the next fiscal year and forward. It is really limited to specific evidence-based programs that are MCV eligible programs. So what that means is there are 3 different evidence-based programs that would be eligible for these funds. So it's a step in the right direction. And we are excited to see us moving in that direction to cover these costs. There was a pilot that was funded this year. It begins 2017, runs through 2018. It's in Dakota County. It's a birth through 8 pilot. So the focus is tracking what we are doing with our young people and being able to prove through a data system or being able to track them long term, like, are we meeting some important developmental benchmarks. So the county has already begun working across their different departments to ensure that they have the right outcomes for young people and that they can be successful in school. So county public health, human services, the school district, and many other public agencies have been working together on this effort. And they were able to receive some resources to track that and and be able to give us that data and share that across the state. In that, it's families who are eligible for this are required to receive some type of home visiting services, and then also connected to other important services such as WIC. In the education bill, we also saw a couple different efforts that support home visiting. Parent-Child Home is one of those evidence-based programs I had mentioned earlier. This is a literacy-focused program. They did receive additional resources this year, and it goes directly to the Jewish Family Children's Services. They then will provide grants out to other entities. Last legislative session, or excuse me, 2 years ago, they had an increase in resources that allowed them to go out to Greater Minnesota and to bring these resources or these programs out there. What's been nice that we've seen as a result of that is many times families will receive home visiting services up to the age about 2, and then families are still needing some type of support. So this is a nice program that complements and continues to work with families. Yes. I can. Yes. So the question is, can you give us a little bit more information about the program? Like, what is the focus? So it's a literacy-focused program, and I'm going to say this cautiously because I know enough to be dangerous. So we'll probably need some people to fact check me. But my understanding is that it is both. So it complements both home visiting services and meeting the maternal needs of the mother, the health and well-being of the child, with the focus of literacy. So they're constantly paying attention to how does literacy help build on some of the other skills that young people need. So that is my understanding of that. Is there anyone here who could say more? Okay. And I'll make sure that I'm accurate. That at least I know is true. So we're excited to see them continue to receive resources and have a base increase. And then there were additional resources put into ECFE for their home visiting services. So many of you know ECFE is a great program to provide parent education. Most times families come into a public setting or a community setting to receive parent education services. They did receive additional resources so that isolated families could receive parent education in their community or in their home. So that was another win in home visiting. I think I have covered all the home visiting this session. So we were excited to see the bipartisan support and all the advocates coming together. People see the importance of starting early and working across systems, bringing our public sector and nonprofit sector together. So thank you.
So we will be doing a roving mic following the last presentation. And so at this time, I'd like to call Senator Ralph to our podium. Thank you.
Don't worry, I'm not going to go through all of this. Let's see here. Okay. What I want to talk a little bit about is the Focus on 5 group, which has been alluded to a couple of times. But what this was a group that was set up as a working group to focus on 0 to 5 children and the delivery of services, and to try and, as most of you probably have already seen, bring some sense of order to what is really truly a chaotic situation out there in terms of the delivery of services. And what we intended to do was kind of evaluate the delivery of these services on a common ground and try and just bring everybody in. And I'm sure I think I see some faces out here that I recognize from presenters at the working groups meetings that we had. And if I don't acknowledge you, please forgive me. We had a lot of people there. I think our last meeting we had over 100 people that came. And we kind of tried to keep it basically a less formal approach, kind of use a free-floating dialogue and allowing all participants to have a chance to visit. And in many cases, we actually ran over the allocated time because people were just providing such wonderful information. What we did was we had some formal presentations by Dakota County, Hennepin County, and the Department of Health, Commissioner James Koppel. Additionally, we had programs presented by many of the various services that were that are being provided, and the groups. Head Start, for example, we had some information. I want to thank NAMI for their participation. Mental health is a very important issue to me, and so one of the things that I was glad to see was that participation at the early end of the phase of the programs. The conclusion that we came to was from the very first meeting that there's a lack of exchange of information between the silos, if you wish, and even within the county organizations themselves, let alone getting up to the state level. And this became evident, I would have to say, within the first 10 minutes of the first meeting we had. And it just followed, that whole theme followed through. And so what that did was, it kind of focused our group's efforts. So what we finally ended up with, and these are just a few more services, were hard for parents to find. Evaluation of program success was difficult. Resolution of issues was hindered, and early development needs were not shared with school personnel. That was one of the big things we found, that there was absolutely no crossover between the Department of Education and the Department of Health. And we felt that this was something that needed to be looked at and opened up and tried to explore. One of the earlier speakers mentioned the Dakota County project, and I want to focus on that because that really is kind of the overriding outcome of this focus group, was to actually get a project that would study this issue of not only data communication, but also the actual mechanics of the delivery of services. And finally, the evaluation. I want to talk about evaluation for a moment. When we first started the project, one of the things that I did was get an inventory of of as many of the services that I could find that were provided to young people between the ages of 0 and 5. And of the 18 programs that I was able to ferret out, less than half had any formal method for evaluation of their success. In other words, was the program actually effective? That just blew my mind. I couldn't believe it. More importantly, of the remaining programs, only 2 had actual formal objectives with metrics for measuring it. The rest, their main metric was, did they add clients? Did they increase the number of people they were serving? And I kind of thought that's a little bit counterintuitive. It seems to me if your program's working, your numbers should be dropping. People should be improving, and the need for those services should be disappearing. So what we did was, in working with Dakota County, we created some legislation that would do a couple of things. First of all, it enabled any agency, and we use the term welfare agency with a rather loose definition. We changed the definition of that a little bit to allow more ease in communication and to encourage communication between those silos. Secondly, specifically in the law, in the legislation as established, we set up a coordination between the Department of Education and the Department of Health at the county level. So your education departments at the county, the school districts, and the welfare departments were directly given the authority to communicate. Now, one of the big things we did was we made this an opt-in program, so you don't have people suddenly finding themselves in a program that they didn't want to sign up for. The hope is that when a child comes into the system, they will be identified in the system as now participating, as receiving services. But more importantly, as those services continue and home visits take place, and I want to talk about that in a minute, but as home visits take place and needs are identified, for example, if there's a developmentally disabled child, that immediately the system becomes aware of that, so that the parents don't have to go looking for the programs that will help that child. Those programs will come to them. And part of that is then through the school districts as that child progresses on. And one of the things you'll find is we talked about 0 to 5, but the Dakota Project actually goes through 3rd grade. So we're going to not only pick the children up before they get to school, we're going to continue to track them once they reach the actual formal schooling, and to try and create a system where not only do they get tracked within, for example, Dakota County, but hopefully this will eventually grow. This pilot is designed to eventually build a system that will go statewide, so that when a child moves from Dakota to Hennepin County, for example, there will basically be a packet that will follow them. And that information will now create a system where the new school district will know we have a child in that system that has special needs, or that is receiving assistance, and will be able to deal with that on a proactive basis. So that's something that I'm really excited about as far as what we did with this pilot project. And moving on, I want to thank the people. If there's anybody here from Dakota County, I want to clearly make it very clear that they played a major role in this, in the information they provided. But basically what's going to happen is there will be milestones, and there will be actual metrics where we will take a timeout, say, let's evaluate how this program or the programs that this child is participating in, is their progress. And there will be specific metrics to measure that, and if the answer is no, then we're going to retool and start over. We're going to say, wait a minute, well, why isn't this child progressing? If, for example, if they're receiving nutrition and then the child's needs they're still not advancing, why not? And try and do some fine tuning, and that's the whole object of this, is to examine the whole system to make sure that when we deliver services that they're effective. The other thing that will happen is we're going to try and look at overlaps. And we found that just in 2 or 3 areas, for example, delivery of childcare, there's 3 different programs out there. They're all delivering childcare. So what we'd like to see eventually is one of the silos say, okay, we got it. The rest of you can step aside, and we'll make sure this person receives the services they need. And that will make it much more efficient, which my hope is to free up some monies that can be used for some of the things that didn't get funded by removing these inefficiencies. So that's kind of the project, and it actually will continue. It does continue beyond 2018. The program is actually set up to run through 2021. That's when its final report to the legislature will happen. There is an annual report in February that's supposed to come to the legislature, to the legislative committee. It should probably come to Human Services Reform, which is the committee that I sit on. I'm sure it will also go to the education, the E12 Education Committee. So we will be looking at this. This is not just some kind of an empty program out there that's kind of turned loose and let run on its own. It's going to be, every year there's going to be a report, and I'm very pleased to be working with Dakota and what they've done, and Kelly Harder and the other people there have just done a marvelous job in working on this. So that's basically what the program does, and I did want to drill down a little bit on it so that people would understand what we were trying to do and how it's going to hopefully affect the whole delivery of services for children in this area. And I didn't have time to get it on the PowerPoint, but I just wanted to show this. This was kind of the first shot out of the box that Dakota County brought in with us. And this is their program for the metrics for establishing the various forms of evaluation that they're going to be using. And it's expanding and is a well thought out program. So with that, other than a couple of comments, first of all, we did actually, as part of this project, did increase some funding for the infant and home visitation and care, and it actually came as a part of the funding that this project brought forward. So I was very pleased to be able to put those two together in carrying those two bills. So at that, I'm going to turn it over to the moderator, and I'm sure there will be questions, and we'll go forward from there. Thank you very much.
Thank you very much, and thanks to all of our presenters. Now, what we want to do is we've got some mobile mics, and there's one. You are it. Okay, but here's the deal. We have to coordinate the answers with the questions, so that we're going to do a little running around. But we have about 20 minutes, and I'd like to open it up for questions to any of our presenters. So we got a hand over here.
That's on. This is for Senator Ralph. So the funding, I mean, this is very exciting. Thank you very much. The funding is only going for till 2021, but isn't this a 0 to 8? So how do you know in 4 years if a program is really working? Don't you need to go till 2025 to find out if so? That's the first part of the question. Then I have a very substantive question about, since it's a literacy program, that I want to ask you about.
There we go. As far as through the program, part of the problem with getting it out to 2025 is that we really basically only, what we call the tails and the funding, only go out to 2021. And so basically, at that point in time, we're hoping that the report to the legislature will deal with children that have already started in the program. In other words, you might have a kindergartner that would have the period of time to be able to be evaluated. It will also deal then with younger children, and hopefully we pick them up. And my hope is that by 2021. We will have decided, hey, we've learned enough about this to actually be expanding it. And I was just visiting with some people. I think Jim was here. I don't see him, but we were visiting about the continuing of this focus group, this 0 to 5 focus group, and actually starting the working group and continuing to examine this. This is not something we're just going to let sit aside. So this is a work in progress, and that's kind of the intention here.
Okay, so this is a literacy program. You're going to be looking at reading. That was one of the things that I saw in one of the reports. Now, one of the challenges is children becoming literate in their own home native language. I believe a couple of years ago in the legislature, we did put that in, that we need to support home language. The reason is that there's so much research that shows if children are not literate in their own native language, their learning of the second language is much delayed. So what effort is going to be put into making sure that, say, for example, Somali children that might have illiterate parents actually develop literacy in their own language, or else when you get to grade 3 and it's going to look like a failure, it really isn't a failure because those kids never really got the support they needed to be literate in their own language to then pick up English.
Okay. As I understand the question, we're dealing actually with two things. We're dealing with in-home, and then we're also dealing with the Board of Education in the various school districts and how they set that up. And one of the things that, frankly, as I said, this is a work in progress. The big thing we wanted to do was to get the education people and the human services people talking to each other, because they weren't. And the people at the meetings were very candid about that. They said, we don't talk to each other. And so the whole object is, let's get it started. Let's see what happens. And as we go forward, of course, the metrics as they are developed, especially as they're developed for once the child starts school, will have to include evaluations of the language barriers and the learning process. One thing I would point out that we found in One of the things we did do was made sure that we engaged the American Indian community. And they were very pleased because what happened is in many cases legislation would get passed and then they'd be told about it. Well, I met with the ombudsman for the community, and we talked about this, and we included them in some specific conversations with the various tribes in the state. And there is specific language in the legislation that includes them in this program, so that programs actually on the reservations are included, and they are included in the data sharing if they so choose to be. So in that respect, we are including that community. In terms of bringing in, I have a very large Somali community in my district in St. Cloud, and we're working with trying to get them through the school district to build them up. And I have to, as an aside, say that one of the great rewards that I had in coming into this position was to meet with some of the younger children that are now actually graduating from Tech, and some of them from Apollo and from the colleges, and to see the progress that they've made, and to see these young people who have learned the languages and who are actually going on to higher pursuits. Talked to a young lady, she's going to medical school eventually. Just graduated this past year. So this is hopefully, and I know this isn't a very specific answer to your question, but it's on the radar, and it's going to be part of the development of the program.
Great. Thank you. Another question. Yes, Angela.
Can you share some of the Dakota County metrics that you were talking about that really got your attention?
Sure. Well, for example, we've got some developmental metrics. Risk factors from birth, less than 2,500 grams birth weight. Parent less than 20-year-old, single mother, enrolled in MA WIC or social services. These are some of the metrics that we look at to then, okay, those are the things to identify, help identify children at risk. Then as we go forward, 0 to 36-month developmental screening, there'll be vision, hearing, screening indicating concerns, behind on immunizations, enrolled in MA, or have they been brought into the system? These are just a few of them, and as I say, the ultimate metrics that were developed they were not obviously included in the legislation. This is part of the whole reason for the pilot project is to again, it's a work in progress. And one of the reasons I want to reconvene the working group is I would like to get outside of the annual report to the committee, we would like to get kind of a rolling update from Dakota County to find out how this is working. I'm also told that a couple of other counties are seeking to opt into this program if they can, and we're going to see how the funding on that works. But a couple of other counties have said that, in fact, one of them has even said they would provide county funding to do it. So if this thing takes hold the way we hope it does, it may grow naturally, and that's kind of. But the whole idea was to get the ball rolling, and as to the actual specifics of the metrics, those are being developed. But these were just some of the things that we identified at the early part of the meeting, and they're now developing the program. And in fact, I'll be in contact with them as we go forward. So I wish I could give you more specifics on it, but as I say, it is a true work in progress.
I just have one other comment as we move forward. We were talking about looking at efficiencies and how systems are duplicating, and over time you thought that particularly like enrollment would particularly drop in a certain program. But I just want to keep it on our radar. So many programs are developed to look at communities, not in partnership with communities. And so when we look at cultural competency, sometimes as systems become more proficient in that, enrollment does increase because we're starting to meet the needs of communities in a different way. And so that's a really key indicator to me around cultural competency. What does that look like for mental health? What does that look like for WIC and other programs? Beyond language, but about real cultural indicators that make parents and families really want to feel comfortable, trusted, and value a particular service or a system.
Oh, I guess my comment is that the point that I was trying to make is that if you're only measuring the number of people you're serving, you're not actually finding out exactly whether those services are being delivered or how effective those services are that are being delivered. And my comment was basically on the idea that there are programs, obviously, if they're doing a good job, they are going to be getting more people into it. But ultimately, for example, in a developmental area, if a child is behind in development and the program is helping let's talk about their reading skills. If the child, if the program, the reading core and the math core, for example, are successful, then ultimately that child should no longer have to be in that program because they will now be up to competency with the rest of their peers. And the idea here is what we want to do is, we know there's programs out there that are doing a good job. We want to find out why, and then be able to tailor that so that we can be more efficient in the delivery of the services. So I guess I hope that answers your question.
Okay, thank you. We've got a hand up here in front, and obviously feel free to ask Sue and Laura and so forth other questions. So, yeah.
To the federal healthcare situation and the looming threat to Medicaid funding in particular, and the impact on the state budget that could represent. I'm wondering what your reflections are on the Better Care Reconciliation Act or the American Health Care Act, and how that impacts our ability to fund and provide any of these services in the future.
Okay. Yeah, that's the elephant in the room. Unfortunately, at this point, I'm not sure where things are going. We did backfill, as was noted, some of the shortfall. We saw that coming in the revision of the Medicaid provisions, and we did try to backfill some of that. We're seeking some waivers that will hopefully help go down the road. But at this point in time, until we know what happens, there's not a lot that we can do other than try and be a little bit proactive in looking at our budget. And that's, in fact, one of the reasons that the Human Services and Health and Human Services Omnibus Bill was constrained in the way that it was because we knew there's things going to be happening. And we're trying to position ourselves to be able to be reactive to that. And we're really in a situation now where it's hard to be proactive other than to say, we know this is coming. We know these are areas we have to focus on. And I mean, the Health and Human Services Committee has got a tough job. Yeah. That's a separate committee from the Human Services Reform, which is what I sit on. But I will be very candid, it's a tough issue. And we're not sure where it's going to end up. There's going to be some kind of reform, that's pretty evident. But what form it takes right now, the people in Washington have to get things together and put something forward. We know that the current state of affairs can't continue; it's unsustainable. We know that. We know that the health insurance companies they're going to leave. The individual market is going to disappear if we're not careful. So there is going to have to be some change. What form it takes, I mean, I've been watching it just as I'm sure most of you have, and I very honestly can't tell you where it's going to go right now. We're going to see some kind of reform. The news may not be good. The only thing I can say is that we did have a system in Minnesota before Obamacare came in that was one of the best systems in the country. It did deliver services. It did deliver insurance to people, and the people that didn't have it still ended up getting treated. And unfortunately, that was somewhat dismantled by what happened. The MSHED program was a very good program. It helped people get care and get insurance. And the ones, interestingly, if you study what happened under those programs, while there was a great deal of talk about people being uninsured in Minnesota, the truth is that they were uninsured, but they were not untreated, and that they would receive care, and that the hospitals basically and the providers would absorb that, and it was built into the system. So the lack of identity, I want to call it, between insurance and delivery of health care is something that I think people fail to focus on. And that what we need to do is we need to look at, is everybody getting health care? Not do they have insurance, but do they get health care? And I think that's something we have to keep in mind, that the system we had provided a pretty good way to do that. Now, we're not going to be able to go back to that. And I don't know if Dave has some comments on that too. But that's kind of the way I see it right now. Dave, if you have some...
And I'll just point out that the uninsured rate did drop by half after Obamacare, recognizing what the senator had to say, and we'll continue the debate at some other point. But just to recognize that as well. So, but I'll turn things to the...
It's complex.
It is complicated. I think we can all agree it's complicated, right? Whatever your perspective is. Actually, it's surprising how complicated healthcare is, actually.
So...
any other questions that folks have?
Okay, so I'm going to call...
Sorry, I couldn't resist.
Okay, and I'm going to call on Sue Abderholden.
So I have very strong feelings about this. And I just want to say that if either of those bills pass, and I actually have read them, we will absolutely decimate our mental health system. Prior to the Affordable Care Act, mental health benefits were not required for individual and small group policies, and that is huge. And so because of Medicaid expansion in particular, we were able to get more people who access mental health care than ever before in our state's history. Over 50,000 people were able to access it. When you look at who accessed Medicaid expansion, it was young people, 18 to 30, when serious mental illnesses emerge. And that includes moms, right, between the ages of 18 and 30. And so that was a really important piece. With all due respect with MSHA, we just need to remember that MSHA actually required you to go 6 months without the insurance covering the condition that didn't allow you to get a plan in the open market. So you would have to go, if you had a pre-existing condition, including postpartum depression, you could get MSHA, but you would wait 6 months before you actually got treatment covered, which is a huge issue for us. So, I just want to say that we finally have mental health starting to be covered like other healthcare issues. This would absolutely take it away.
Mm-hmm. Mm-hmm. Okay, another question. Here's one. Yeah.
I think this is less of a question, and I guess now I get to sort of kind of as Jessica and I were putting together our PowerPoint slides, we were trying to be extremely fair to both what happened, what couldn't happen. But I do want to sort of make a statement, particularly about the legislative session and certainly about what some of the conversations that are happening around healthcare. Just as is true at my house, when I develop a budget, my budget says something about my priorities. So if there's an undue amount of chocolate that is purchased in my home, it's because chocolate is a priority in my life, right? And conversely, I think as we think about budget, as we think about the HHS budget particularly, that impacts so many young children and families, I think when we think about the amount of investment and where those investments happen, it really says something about our priority. And as we as a community believe that children 0 to 5 and beyond, because we do like our older ones too, are important, then we need to think about how did this last legislative session's budget represent that priority and that reality. And I think that is important. And as we have conversations about how the state will address whatever is done around health care or different changes to education that will be coming out of the federal government, I think we have to think about what do we want to say as the state of Minnesota about, and what our budget says about where our priorities are about young children. Sorry, that wasn't a question. That was another editorial comment.
Yeah. Okay. I think.
So I think we're going to go to a break, and I just want to point out, so much of this is called a forum, right? And so the purpose of what we're trying to do here is to bring all of us together. Everybody in the room cares about the welfare of kids and little kids. There's a question of how we translate that caring into action and into policy, and how we do that. And so strikes me, this is a good opportunity this morning, but hopefully this continues all the way through, of really pressing one another and pushing and figuring this out together. And so I appreciate Lars for bringing up the question, and Senator Ralph for his engagement, and the rest of us as well. We need to keep on doing this because the one thing is, we all, I think, can agree, the first step is lots of attention on little kids, right, and on young people who, of course, have such potential. And so we need to do is have that attention, have that focused attention, and then turn that into energy and into action and results. So with that, I think it's time for the break. Is that right, Jane? If we could please take our seats and have the panelists come up front. Panelists up front, please.
Well, thank you, everyone, for getting to your seats and helping us get started. I just want to make a special shout out at this point to the staff at the University of St. Catherine, and of course to St. Thomas here for the generous support we've had. This is totally done with their generosity, and we don't pay a dime, so we're really blessed. So we have a panel, and I'm just going to give everybody one quick overview as we're going to kind of work our way down the table here. And the basic point I want to say to the panel is just move the standing mics and hold the mic close enough that you are kind of talking into it, and then just pretend you're talking to somebody kind of across the table so you don't have to shout, okay? So we're going to begin with Daniel Gumnett from representing Mini Minds from People Serving People. And,
thanks, Jane.
And here's the clicker. I'll give it to you.
Thanks. Okay, everybody, can you hear me? Great. So let me start with talking about the values and the child-centered approaches that is at the heart of what Mini Minds is about and where we're looking next year. And equity, which we really think about as racial, economic, and geographic. Prenatal to 5, whole child, multi-generational, high quality, parent-directed, mixed delivery, and research-based. That is informing everything that we have been doing and will inform our work next year. I know this is in the past tense, but let's pretend it's in the future tense. So increased access for the highest need children 0 to 5. That is what we are all about. And when we talk about that, that is children who are experiencing homelessness, in foster care, in need of child protective services. Those are the areas that we at Mini Minds are really focused on now and will be again next year. Mixed delivery is very important. That means we will be caring about scholarships, home visiting, and CCAP. And I think we were quite disappointed to see the CCAP results in the past year. And yes, Barty, that was an editorial comment. It's okay now? Okay. And high quality, which has always been something that Mini Minds has been really focused on and will be focused next year. We care about parent aware and will continue to do that. So home visiting is really something that had not been part of Mini Minds years ago, but is central to what we're caring about now and what we're going to care about next year as well. And there's been some great presentations already today about what has happened with that. So there is a lot to do next session to dramatically increase access for the families who currently can't afford quality, all-day, year-round, parent-directed. Quality, all-day, year-round, parent-directed early care and education. That is what we're going to focus on next year. Okay? 1 minute. Thank you. We will not back off into all kids who need it have access to quality care. And we are going to continue to make sure that young children are at the center of the legislative agenda. And we hope that some of the bipartisan leadership that began in the previous session will continue next year, and that our youngest and most vulnerable children facing challenges will get access. But I think it's going to take some really bold action if we're going to make a difference in the 2018 legislative session. Thank you very much.
So one thing I just want to mention is that while I'm head of NAMI, we're also part of the Mental Health Legislative Network, which is 40 organizations working to improve the lives of children and adults with mental illnesses and their families. So for the 2018 session, we're going to go back to what we're calling our macro bill. A huge part of this is making sure that MFIP child-only parents, so they've already been deemed disabled by the Social Security Administration, they are not eligible for childcare. This is a problem because if you have a parent who is on disability because of their serious mental illness, they may need to have intensive outpatient treatment. They may just not be doing well, and we want that infant and child to be connecting to an adult. We don't want to wait, frankly, until they're in the child protection system. We already know this already creates an at-risk situation, and so we have tried this bill for over 4 years, and we really think the time has come to make sure that these families access that child care. I would also mention that we're looking at amending it a little bit so that it's not just a mental health professional, but because of the opioid crisis, we want to make sure that any moms in particular who may be, facing addiction issues are also able to get into outpatient treatment and get child care for their family. The next one was already passed, so we can skip that. We're also including grant funding for the multi-generational mental health treatment and services. We want to make sure that we're really addressing and supporting whole families. We currently have at least one, and we know some folks who are wanting to do another, where they're actually doing an intensive mental health outpatient for moms who are experiencing postpartum depression, anxiety, or psychosis, where the baby is with them. But they are paid the same rate as any other outpatient treatment program. So we want to make sure that they actually get the higher rate since they're dealing with both the baby and the mother. Catherine Wright is here. She's done such great work with the early childhood mental health consultation grants. We have been unable to get increases in this, but the demand is so high, and we have folks who have really been, who are certified to carry out this work, so we're going to push to get more money for that as well. The other thing I just want to mention is we'll continue to come back for school-linked mental health grants, which actually do go down into some early childhood programs as well. It's what I like to call the best thing since sliced bread, since the services go to where the child is. The parent doesn't have to take off of work, look for transportation, figure out where to go. It's right there, and we eliminate all barriers to accessing care. The only other thing I just want to mention is we're also part of a postpartum depression coalition and are looking at bringing in some legislation so that we can actually have people who are certified in providing treatment to these moms so they're actually doing it in the right way, including the child.
Thank you. I am not Barty Wahi. I am Diane Halsey, and Barty asked me to come up since she'd already been up before and represent Voices and Choices for Children. I am Diane Halsey with Think Small, and I co-chair Voices and Choices for Children. And just a brief background, we are a coalition of people that have come together on behalf of children of color and American Indian children in the state of Minnesota to advocate on their behalf. And so actually, if there's any coalition members in the House, can you please stand? There might be a few still here. I think I saw Melvin. Anybody that's attended a coalition meeting, Angela's here, and I think I saw Nicole there in the past. And others I know have come, they're just not standing. But we are actually a pretty young coalition, but have covered a lot of ground in a short period of time. And we're moving forward kind of, what did I do? Okay. Here we go. What we are moving forward, we're kind of building off of the work that we've already done. This past session was our first session that we actually carried a bill forward. It was mentioned earlier, the Community Solutions Fund. Unfortunately, it did not get a hearing, although we made a lot of ground, I think, in actually talking and getting some authors on the bill. And so moving forward, we continue to move that piece of legislation forward, hopefully next session. But in addition to that, we're also looking at doing asset mapping. As I mentioned, we're still pretty young, and we're wanting to build off of all the people that have come to our coalition to see what are all the assets that we have that we can build off of and the resources that we can bring. In addition, we're doing parent advocacy training. We've done that in the past, actually training parents of color and American Indian parents to actually learn how to advocate on their child's behalf in local settings, but also at the legislature as well. In addition, one of the things that we do even outside of the legislative session, we've been working administratively with the department heads and held some listening sessions last year for the Department of Human Services. And we want to go back to those providers and parents that we've talked with and talk with them again about what are some of the needs that they're seeing. And finally, we want to finalize a legislative agenda for next session. And I would just, in a couple seconds I have left, just actually just kind of give an open invitation to all those, just a brief explanation. We invite any and everybody to come to our full coalition. We've had a lot of people come that have been, everybody's input has been tremendous help. We do have a small steering committee that is people of color and American Indians, and if you're interested in being on that too, please let us know. But we welcome all to come to the full coalition. So thank you.
Good morning again. So looking ahead to 2018, as I mentioned, there were new resources for targeted home visiting, and the coalition will be spending the next year, for sure, working with the State Department of Health and also our local providers, local and regional providers. We really want to be sure that we do a good job with the resources that were provided to the state. So the coalition is actually going to be putting some of its time and energy into supporting programs to be successful, specifically around collaboration. It was an important part of moving this legislation forward. We want to bring the public and nonprofit sector together, or two different nonprofits or public agencies together to better serve the needs of families and in communities across the state. So we are spending a lot of our time focusing on implementation of the new grants. And with that, we mean that we are focusing energy on providing training and professional development for programs who are offering services to our highest need families, and then strengthening these collaboration efforts. The coalition actually focuses on two really important issues for the field. We focus on policy and advocacy, but we also want to build the infrastructure in supporting high quality service delivery. So that meets some of the items I just talked about will satisfy our desire to make sure we're providing high quality services to families. We will meet in August to actually set a legislative platform, so this is a little early for us, but I will guarantee we will be there to protect the resources that have been offered up to serve our high need families. And we, in the past, have begun conversation, how do we make sure we're increasing access to the highest need families, knowing they're highly mobile, and we want to make sure that programs are working together to keep families engaged and in services whenever possible. And then previously we've had conversations about workforce-related issues, and so while we haven't had our meeting yet, those will be things that we'll be discussing related to home visiting, and encourage you to participate if you haven't already with the coalition. And our contact information is here. I can make myself available to you, but we'd love to have your involvement if you're providing home visiting services.
Good morning. My name is Lars Negstedt. I'm the policy director for Isaiah. Isaiah is a statewide organization of clergy, congregations, and people of faith working for racial and economic justice. And we are co-chairs of the Minnesotans for Paid Family Leave Coalition, along with Children's Defense Fund and about 24 other organizations. So just to remind you, the Paid Family and Medical Leave Act has been introduced a couple times. We failed to get a hearing this year There's a great study conducted by Deb Fitzpatrick at the Center for Women in Public Policy at the Humphrey School, about a 200-page document that looks at other states, 4 other states that have existing paid family leave policies, and building that out and what that could look like here in Minnesota. So the need for paid family leave is great, and I think the recognition of that need is growing. Access is unequally distributed. Just 13% of workers nationally have access to that paid family and medical leave. Personally, I'm a father. I have a 5-year-old and an 8-year-old daughter, and I was very fortunate to take a significant amount of leave with both of them when they were born. And so I just have a personal stake in this as well, and I think more men need to take their parental leave and demand equal parental leave, because it's an equity issue on both sides, and that allows more. That's another step in solving the gender equity pay gap for women. So this act that we have introduced, Senator Susan Kent is our current author in the Senate, and Representative Jason Metza, along with Representative Peggy Flanagan, would provide up to 12 weeks of partial wage replacement for pregnancy or medical leave, and 12 weeks during family leave. The cost would be very minimal, about the cost of a cup of coffee a week, shared by employers and employees. Levels the playing field for small employers who can't currently offer this. It saves lives and creates better health. In this past session, we spent a lot of time defeating some solutions that we felt did not work and actually would only exacerbate the problem, including tax credits and family leave savings accounts. We successfully defended paid sick days, many of us in our coalition, which are now in place for 150,000 workers in Minneapolis and St. Paul. And I wanted to note that Washington State just passed, with bipartisan support, a very strong paid family and medical leave act. So going forward, speaking now more for Isaiah than the coalition, we're focusing on grassroots organizing and listening sessions across Minnesota. We'll be having thousands of conversations to raise awareness and to listen to people's experience with the need for access to care. This is not just for children, but also for elderly care or serious conditions for individuals. Those conversations are going to include an explicit racial analysis, because we think that a big part of the problem in passing new programs and things such as paid family leave is the conception among white voters that public programs benefit only people of color and therefore are not worthy of their own political support. So we are doing a lot of work testing new messages around that, understanding where people are coming from on that, and just diving in head first and not skirting around the racial analysis issue, but having that front and center in our campaign to win paid family and medical leave. Thank you.
Me again. Jessica Anderson with Children's Defense Fund. We're an organization part of the Kids Can't Wait Childcare Coalition. And this is a coalition, that supports solutions to address Minnesota's childcare challenges. Specifically, we advocate for increased funding for basic sliding fee. As probably everyone is well aware here, there's about 5,000 families on that wait list. We support higher reimbursement rates for CCAP providers so that families can better find affordable care and providers can afford to serve them. And this past year, we took on supporting, again, what we dubbed the family-friendly CCDBG requirements in alignment with national best practices in an effort to improve the program for children, families, and providers alike. We also supported, I don't know how I left this off considering we're successful in it, the Child and Dependent Care Tax Credit expansion and increase as well. So that was another priority of ours. So lo and behold, we have not solved the child care crisis, in case you didn't notice. And so this coming year, we look forward to building a robust campaign. We have to continue work on all of these areas. We have to continue to chip away at those family-friendly requirements. And although, like Laura, we're still going to be holding our, a big planning meeting in August, I can assure you that these will be among our top priorities again. And with that, I think that's it. And I should add too, please do contact us if you're interested in joining, being a part of our meetings. I'm pleased to say 5 of the people up here are from organizations that are members. And then I see
Leah out there with the YWCA as well. So please feel free to join. Thanks.
Good morning. My name is Nora Springer. I am with Early Head Start here in St. Paul, part of Community Action Partnership of Ramsey and Washington counties. Gail Kelly is on vacation this week, so I will do my best to give a quick update on behalf of our Minnesota Head Start Association. So Early Head Start is the prenatal to 3 extension of Head Start. Our focus is on providing support and education in the areas of healthy pregnancies, labor and delivery, infant and toddler development, and overall family well-being. We are federally mandated to ensure that our enrolled families are up to date on immunizations, dental screenings, and well-child checkups, and we also do ongoing nutrition screenings, oral health screenings, and developmental assessments. Using this whole family, whole child approach, we are seeing great outcomes and increased school readiness in many areas for our EHS children going into Head Start, as well as across our 0 to 5 program. Early Head Start programs across the state have some variability in how we serve our communities. For example, here in Ramsey County, we are exclusively a home visiting team, whereas Pica in Hennepin County, for example, offers center-based Early Head Start along with their home visiting model. We also have a number of partnerships with local childcare centers in locations across the state. Our current enrollment numbers, as you can see here in Minnesota, include about 3,300 pregnant mothers and babies and toddlers that are receiving services. And as you can see, we have 53% racial diversity, and we also are serving 9% of the homeless and foster care population. A few highlights from last session that we are looking forward to include the expansion and prioritization of early learning scholarships for children 0 to 5. This expansion will be beneficial for working parents and families in our EHS center-based and childcare partnership programs. We also support the increased reimbursement rate for pediatric oral health services, because with only 37% of Minnesota children on Medicaid receiving dental services, this increased access for our EHS and all Medicaid families is definitely much needed. Finally, the additional new funding for home visiting is an important boost in supporting prevention programming, and we're excited to see what new programs we may be able to collaborate with, learn new techniques from, as well as support our own programming needs. A big part of what we do involves accessing and referring to community resources, as well as collaborating with our public school system, our county health departments, and our child welfare departments. This year, something that we are focusing more on is increasing our collaborations within our communities. Our community touchpoints are far-reaching in Early Head Start, and we are always looking for ways to work smarter and more effectively within our communities and layer resources for areas that are outside of our reach. If you have any collaboration ideas, please reach out to your local Early Head Start teams or talk to me afterwards. Valerie's here, so that we can better serve our Minnesota families and babies.
Thank you. Similar first name, same last initial, but I am not Clara Sharp, and I am not a doula, so should I just move through those slides if we don't have someone on for? Oh, okay, it was just that slide. Well, it's me again. I'm still not a doula. I'm Claire Sanford with the Minnesota Childcare Association. I'm here on behalf of the Minnesota's Future Coalition today, and thank you, Rep. Pinto, Senator Ralph, for hosting this again. And before we continue, of course, we all talk about how we need more money and we need more stuff, because we do, and we know we do, but thank you to the legislature for the investments that were made on behalf of young children this year, because we did take a lot of big steps forward. So thank you for all of your work there. Minnesota's Future is an intellectual sort of coalition, I think, and I always show this slide. These are all the member organizations. And we're a coalition of principles. We try not to get in each other's way. We try to collaborate as much as possible. We do host Policy Hour the first Tuesday of every month, September through June, which is free, bring your lunch, hear a different policy topic involving early childhood or school age every month. So come to those if you don't already. And I wanted to take the opportunity also to put in a plug for the CARE Fellowship. Katie Williams, who is one of the founders of Elders for Infants, it's the Katie Williams Childcare Advocates Ready to Emerge Fellowship. Many members of Minnesota's Future are also part of the collaborative that put this on. And there are many CARE Fellow alums in the audience today. I'm sitting next to one of them. And we need more of us. We need more people to advocate for young kids. So this is across all early childhood and school age field, home visiting, ECFE, public school, higher education, childcare, everything. The application is open for our next class, and it's on the Manesi-Minsaka website. So looking ahead for Minnesota's future, completely honest, we haven't gotten most of our legislative stuff together for next year either, and we communicated over email going, oh, what are we going to say? And one thing we already know for sure that we can coalesce around is, which you've already heard about, the need for increased reimbursement rates in the Child Care Assistance Program. The family-friendly policies this year that passed are fabulous. There's still more to be done, but a big part of those got passed this year. But a provider rate increase is huge. It is federal law that the states have to peg their rates to a market rate survey no longer than 3 years old. So currently Minnesota is using the 2011 market rate survey. We need to update that to one within the last 3 years, and we sure as heck need to get the 25th percentile up farther, because this is not only an access issue for low-income families in accessing early care and education, it is a wage and equity issue for the early childhood workforce, because if we do not get these rates up, providers continue to be paid deplorable wages for the incredible work they do. And I mean, I know First Children's Finance, I think I saw Jerry in the back somewhere, reported to the legislature that family child care providers in Minnesota, many of them pay themselves at the end of the day $8 an hour or less. So we've got to make some investments here so people are not making poverty wages to care for and educate our kids. And finally, the elephant in the room was already brought up. We don't know what's happening at the federal level with health care yet, but if something happens, whatever it is, we as a coalition thought we would definitely need to take some time to look at what our response as advocates would be, what our state's response would be, because obviously there is the potential for great harm to be done to a lot of low-income families, and we want to be ready to respond to that. Thank you.
Well, that was a very effective and timely set of presentations. So we're a little bit ahead of schedule, which is always good. And what we'd like to do is open it up for questions. And again, as you're formulating, I just want to call out one person in the audience, and that's Carol Miller. Carol, would you just stand and take a little round of applause? She is retiring from Hennepin County. And we just want to say thank you for all you've done. And we'll continue to be seeing you, I think. I know. You have to. That's right. All right. So thank you. All right. So people, what do you got for questions? And you can address any one of these people here. I want to thank our panelists. It was very, it reminded me a little bit of, I'm reading this Brian Stevenson book, which is really heavy duty, called Just Mercy. But there's one page in it where he talks a lot about the importance of a hopeful stance, that hopefulness is really critical. And I want us to remember that. And I think I heard that today in our discussions, knowing the difficulties that we're helping to try to change for families in Minnesota, and especially with young babies. So, what do we got? Any arms going up here? Jim.
Hi. This is a question for Daniel. I really applaud the changes that Many Minds has made in the last few years to try to include prenatal to 3, but I think it's not enough. I wonder if Many Minds would support just removing the language from the state law that prioritizes 4-year-olds?
Thanks. That's a really great question. I think for a qualifying remark is that Mini Minds has always been 0 to 5. A few years ago, when we started off, we prioritized 3 and 4-year-olds because that was a political expediency, whatever the right term is, decision looking at the political landscape. So the organization has always cared about children from prenatal to 5. I'm not the person to decide whether or not we're going to do that, but that would certainly be something in terms of a language thing that we can take a look at. I hope it doesn't come across as like the organization is being defensive, pointing out that we've always been 0 to 5, but it is a misconception, I think, in the community that we've been 3 and 4 and then have worked our way back.
Representative Pinto, did you have a question?
Well, just for context, could Jim or Daniel just explain about what the change in law, just provide context for that question? Maybe other folks understood it, but I was confused by it.
Well, the scholarship program, which has been put forward by Mini Minds from the beginning, was primarily 3 and 4-year-olds. And then there was an addition of infants if they went to the same program and had a 3 or 4-year-old sibling. And now there's extension to prenatal to 3 for those at extreme risk of special needs and so on. But I think, you know, the research has caught up. Mini Minds really started a long, long time ago. Building this coalition is a wonderful achievement. But the research has kind of caught up and overtaken the idea of emphasizing 3 and 4-year-olds. So I would love it if Mini Minds would sort of join in the effort to prioritize prenatal to 3, because that's where the learning gaps show up. That's where they're created, and you know, why still keep with this 3 and 4-year-old language that's in state law?
Thank you, and I think we all agree that where the action is prenatal to 3 in terms of the brain development and the like. So Alberto, you've been hearing this discussion. Can we talk about this? I do think that Mini Minds is going in the direction 0 to 5, and that the 3 and 4 is a legacy number for us.
Beth in the back there.
Sorry to make you run. I appreciated hearing from the home visiting group that workforce issues are one of your 2 big areas. And I also heard from Minnesota Futures about workforce issues. I think they're highly related to the lower supply we're seeing in terms of childcare. And I hear from coaches who work out in communities across Minnesota about a lot of turnover. So I think workforce issues are huge. And I guess what I'd like to hear is from those who didn't mention it, if you have some thoughts about it, or I heard it in the CDF, but I'd like to ask maybe those of you who work in coalition, if there's some work being done to strategize. I realize it's political football in some ways, but it's really what's affecting quality. So how can we frame this across our efforts for advocacy in a way that is heard about how it impacts these young children? I mean, I think it affects depression for those who stay in the field, so that's going to affect quality. It affects the quality of work that happens with young children all the way up. So some ideas about how to frame this issue as we try to improve quality and keep bringing it up, rather than, I think I hear it hidden in things because we want it to be affected, and I think we need to out it. We need to bring it forward, but figure out how we're going to frame it so that we keep saying the same thing and everyone starts hearing this message from the different advocates. So ideas or thoughts, or maybe there's work already being done on this that I don't know about.
Yeah, thank you, Beth.
I can start off, and then others might please join in. And also, if there's anyone out in the audience that knows more, what I can share, what I know, is that there actually is quite a bit of work happening right now around the issue of the workforce. I think there's a lot of discussion in the field about the fact that there are declining providers, and that's just a fact. In Minnesota, we've had recently a couple of really nice opportunities. There's the National Governors Association. There's a coalition of people that have come together, and if there's anyone that's on that, please speak up. But they are actually talking about and dealing with the actual issue of not just the workforce, but the compensation of the workforce. I myself have become a part of a group called the Birth to 8 Workforce, and that's out of the National Academies of Sciences has had a program. Some funding actually in Minnesota has been one of maybe 5 or 6 states that have been now involved in this, and we've been going through a process and meeting with, it's a group of people that are coming from early childhood, from higher ed, from this people from the departments of education and health, to look at this issue about what kind of workforce can we build that not only meets the quality, but then that's also compensated well. And so there's actually quite a bit of work that is happening right now in the field. If others know more.
I wanted to thank you for the question. And speaking for Isaiah again, we have a coalition that's formed just in the last year called Kids Count on Us, which is a coalition of child care providers. So organizing actual child care providers to advocate for, as part of the Kids Can't Wait coalition, for the CCAP reimbursement rates to be increased, as well as fully funded so that we can eliminate the waiting list and serve all families. I've also been reading just in the past little bit some papers nationally from Caring Across Generations and the National Domestic Workers Alliance, which are looking at universal family care, kind of tackling the problem that a single job no longer supports a family as it might have 50 years ago. And so the change of the workforce, and how do we tackle that? And if we are looking at childcare on the one hand, and long-term care and elder care on the other hand, and paid family leave on a third hand, we're kind of constantly, fighting for scraps against each other. And yet, over those same 40 or 50 years, really over my lifetime, inequality has risen incredibly high. And so much of what funds some of these social programs are payroll taxes, including the Social Security tax, which actually have a regressive structure. So as more and more income is going into fewer and fewer hands, more and more of that is also untaxed and not getting back into the common pool. So could we set a course, this is very ambitious and it would have to be a national course, but could we set a course to addressing that by looking at the payroll tax issue and making it at least flat, if not progressive, unlocking, ultimately billions of dollars of wealth, which we know we have, it's just not being spread equitably, to address this problem and the workforce problem and the supply of workers, and having sustainable jobs and living wage jobs are so important, as we know, to health outcomes as well as to the whole industry.
I can just speak for the mental health workforce, which has always been short. Actually, President Eisenhower's mental health group actually identified a shortage of child psychiatrists. I don't know how many of you were alive when President Eisenhower was in place, but so we've known about this issue for a very long time. In 2013, there was legislation passed to actually put together a workforce summit to really look at how can we bring more people into the field, how can we make sure that they have good training, how can we create a culturally diverse workforce. The plan was developed. Some things got passed in 2015, especially expanding the rural loan forgiveness program, healthcare program to all mental health professionals. One of the barriers, though, that we have found on the federal level, and we're working with Senator Franken's office in that, is that if you're a mental health center and you get certified so that anyone who works there can be part of the loan forgiveness program, you have to be within the walls of the clinic for 32 hours. But our model for children's mental health is not to be in the center, but to be somewhere else. And so we're looking to actually get that changed.
Great. Anyone else want to add to that? I would just say that the Elders for Infants have spent a fair amount of time talking about this same issue because we've seen in parent education that our pipeline is pretty withered, actually, because pay is low and this is a major field of effort. So we want to take a page out of the mental health playbook in terms of how you've looked at the various categories of workers in the early childhood field, everything from psychologists to community health workers, that we really have to understand what are the requirements and so forth. So I would just say we would welcome the chance to play at your table. So there's a great cartoon. I'll send it. We'll put it on the website, but it's from the New Yorker. And it's this, I'm not developmentally prepared to share. You know, there's this little kid that says this, and I'm like, we have to be developmentally prepared to share. So we got to get past 0 to 3. Okay, so another question? Here's one. Good. And then Mary Kay in the back after that.
My daughter works in adoption, and I've noticed that adoption is not really represented in these coalitions, but they also have a huge pay workforce issue, huge turnover at the agency that she is at. I know that it covers more than 0 to 3, but obviously 0 to 3 is included in their work, and I think that is would be a nice addition.
Okay, thank you.
There's someone who was not.
Well put. So let's do up here, and then we'll go back to Mary Kay. We have time.
Well, is it on? Claire is not a doula, but I am. And since the Doula Coalition was not present to speak on doula's behalf, I just wanted to mention that while we're talking about this workforce issue, it's absolutely an issue for the doula community as well. The reimbursement rate for doula support is abysmally low. You're talking about $8 an hour, and at times doula support gets reimbursed at an even lower rate when you consider the number of hours that need to be put in for our 6 prenatal and postpartum visits, in addition to continuous labor support for those mothers. If we're talking about preterm, prenatal through 3 years old, there hasn't been much discussion at all about that prenatal period, and it's so incredibly crucial. As doulas, we are able to do those in-home visits. We're able to connect mothers with resources when it counts. We're able to come in contact with mothers during their first trimester of pregnancy and make a huge impact, and yet we are getting ignored repeatedly. We're asking for a very small increase in reimbursement that is still far below the market rate. I personally have been working with Everyday Miracles. We have data to support our outcomes have a huge impact. I started a pilot program this year in collaboration with Everyday Miracles, addressing some of the issues related to providing that support to mothers. We have the infrastructure in place, we have the doulas, we just need a small increase in funding so that we can effectively serve our families, and that is all. Thank you.
Thank you.
I just want to note, so just a comment about Claire Sharp. So Community Leadership Doula Coalition has presented previously. We were hoping she was able to be here today. But thank you for those comments. That actually led into a question that I wanted to just jump in with for Laura. Have the changes for home visiting, do they encompass doulas at all? Has there been a connection between sort of the doulas advocacy efforts and some of the home visiting efforts that have happened? Because it does seem like there's a pretty strong connection there based on the comments.
That is a great question. I'm not sure I have the answer other than the
funding for home visiting is evidence-based programs. So if you are offering an evidence-based program, that would be something to be for the Department of Health to consider. I know the Department of Health will be hosting some listening sessions to hear from people about how they support home visiting across the state. So we can make sure we put that up on our website and share those dates with the forum here so that folks can learn about those and share their ideas. What I could say and what I would encourage you to be thinking about, and I will share that with other coalition partners as well, that the focus of these resources, the idea behind this when we moved the language forward was to have local collaboration. And so even if your program specific doesn't get funded, we think families are better served when we're working together on their behalf. And so if there's a way to work with an evidence-based program and partner with them, that would be a way that you could approach this. So I would, even if the funding isn't directly for doula programs, you are a valuable resource or invaluable resource to many families. So that collaborative approach would be something that you might want to consider. So don't exclude yourself because it doesn't say doula yet. Attend those listening sessions and continue to have that dialogue about those opportunities.
And Sue.
But our Department of Health staff are here, so if I misrepresented that, please speak now.
And I just wanted to mention that there was a group that got together a couple times, and I couldn't attend all the meetings, but it was led by the doulas to make sure that women who are giving birth in prisons at Shakopee are actually getting the support that they and their child need, and which I think is a really kind of another important piece in all of this.
Yeah, very good. Thank you.
Yeah, and I would just say that on those projects specifically, they are working complementary with evidence-based programs and county public health services. So,
yes, is it Mina?
Yes.
Yes.
So the evidence-based practices, it's come up throughout today, and I know that has been a concern of many early childhood professionals I work with, and I'm also a PhD student at the U of M who's read a lot of the research. And a lot of the samples that the research has done, that the evidence is based off of, do not represent many of our ethnic and cultural communities here. So I'm just wondering, as far as advocacy, as far as lawmakers, whether there's thoughts on building infrastructure to validate practice-based evidence so that they can also be eligible for state funding. I mean, like the federal, I know a lot of it gets pushed down from the feds, and like their screening tools for early child, not a single one of them has been validated with American Indian populations, yet if a program is American Indian and they want to receive funding, then they have to say that they'll use this tool, which doesn't necessarily represent any cultural values and isn't necessarily valid for their populations that they work with.
I can respond to that. I know for the Targeted Home Visiting Coalition, the legislation that we had initially proposed was for both evidence-based and evidence-informed, so that we could take those practice-based efforts and support those as well. We were not successful, so this legislative session, including that language, it's one of the things that we'll continue to have conversation, but we know that there are a lot of great programs out there that are being operated, and we are looking as a coalition to how do we continue to support these great programs, even if they don't run an evidence-based program. So we don't equate them as not, we know that there's some great work being done in evidence-informed programs.
Hi, my name is Stephanie Guzman. I'm a family home visiting program coordinator for Dakota County.
Can you speak louder?
Yes. My name is Stephanie Guzman. I'm a family home visiting program coordinator at Dakota County. And I, too, I'm a doctorate student of nursing practice at the U of M. And I'm new to my role, and I've kind of realized that while we focus on volume, like we've done, 5,000 home visiting, we're not getting the outcomes based. And so I'm curious, with this new legislation, we have both evidence-based model and evidence-informed, and I'm really curious, one of my goals is to start deriving client outcomes from our data, and wondering if we get practice-based data, if we could turn that and propose that into an evidence-based with the legislation. So I'm just curious if there are other ways that we can utilize models that we know work with our clients that we've gotten sufficient evidence for. I'm not sure that that's been discussed, but just asking a question.
So this is Laura, and I would encourage you to participate with the coalition. We do have a group that focuses on practice, and I think the comments and your research would be of great interest to many of our partners and members. So let's connect before the end of the day.
Hi, I'm Dan Solomon with United States Senator Al Franken's office. And I just wanted to say, first, a thank you, and then I guess an encouragement and any reaction as well. Thank you all so much for the feedback for the advocacy and the feedback that you all are providing, especially, related to, as Claire alluded to earlier, whether it's, talks now on Medicaid or the president's proposed, budget cuts. I would, very much want to, on behalf of the Senator, thank you for continuing to engage folks on those issues and members of the other members of the delegation, and to encourage you to continue to do that. And I guess my only ask or request would be, whether it's today or in the days going forward, continue to share those stories with our office as well, as we work to, make the argument for why these investments are so important, and and work with you to make that argument as well. The personal stories that you're able to share are really compelling and very helpful with our efforts, and so would encourage you to reach out to us and continue your engagement on these important federal issues that are coming pretty quick in some measures. And so thank you.
Great, thank you. Mary Kay.
I'm not going to do a question, and Jane, I don't know exactly where you're going in terms of closing up the questions and things, but I would really like to hear from the legislators that are present about the context, if you will, to help us a little bit in your view about the context for the next year's legislative session.
Well, gentlemen, are there others here? We'll give you each 3 minutes. No, I'm kidding. I'm in charge. No, I'm not.
We have a colleague of ours, Representative Mary Konesh-Podine, so I'll call on her in a second. Maybe my thinking is that we'll kind of go in, because I don't think any other legislators are here. If I missed any of my colleagues or the senators, so I guess I'll talk for a couple minutes. We'll hand it off to Senator Ralph, and then I want to make sure that Representative Konesh-Podine gets a chance to comment as well. So Mary Kay, you're asking about the context for the 2018 session. Yeah, I mean, so to be clear, I'm in the middle of my second term in the House. I've been the minority both terms, and as I think many of the folks in the room have lots of, actually I have to say, many people in the room as I'm looking around can provide a much better contextual summary probably than I can. Let me think. There were a number of good things that happened this past session. I will say I probably, in the position that I'm in, am viewing more the opportunities that we have yet to pursue, I guess is maybe the positive diplomatic way of phrasing that. I will say I think that there is a significant financial cloud that's hanging over us right now. It's been alluded to a little bit with actions in D.C. I do think, maybe now I'll add some editorializing, just that the nature of the tax bill in particular that went through, I think that there's a significant risk, and probably we all would agree at least that there's a risk, but I think it's a significant one, that depending on what happens with federal funding, we may be in a pretty difficult position even as soon as 2018 and certainly looking beyond. We've had some comments over the course of things here about a number of regulatory changes that we can make. We've talked about sharing data, but ultimately a number of the proposals that have been discussed do take money, right? You saw in the presentation by Children's Defense Fund, just talking about a number of the proposals, and what was sought and what the funding was, and so much of that has to do with the funding. So I guess that's a particular piece that I'm particularly focused on in 2018, or just thinking about, is just that awareness. Because the way things work, for the few people in the room who don't spend lots of time at the Capitol, is that there's a biennial budget that's set in the odd year session. This is an odd year, so there was a budget. It's also an odd year as well. I guess I'll add that as well. Budget that was passed for July 1st of 2017 for the biennial budget. What happens in the even year next year is that we will assess where we at. Are we on track? Do we, as was true 2 years ago, find that we actually have more money than we thought? We've got a surplus. We can now do some spending. Or are we in a position where actually we need to be making some cuts, or cuts of some kind, increases in revenue, cuts in spending, to make an adjustment based on what's happening in the budget? So I guess that's something that's really floating around in my mind. I'll pass things to Senator Ralph and then turn things over to Representative Kanesh-Podine as well.
Excuse me. Just to follow up, I guess what we have right now, of course, is we have an estimated revenue. We don't know exactly what's going to be coming in. If there's more money, then it's possible, as was stated, that we could be looking at a supplemental budget. Typically, we do not do anything budgetary in the second half of the biennium, which means the policy provisions and some legislation that I've actually introduced, policy legislation in much of the areas we're talking about today, will be something that I will be looking at moving forward. Some of it gets wrapped up, of course. We get into the dichotomy of policy versus finance, and that always is a big issue. In theory, budget bills are supposed to be purely about finance. Obviously, there's going to be some policy that's going to have to be included in that, simply to implement the funding that we're talking about. But in terms of context, and again, coming in, as I say, I'm a freshman. It was a steep learning curve. I had never been involved in the services area, and trying to learn that was it's an ongoing job. But what I hope to see as we go forward, as I said, I have several bills that are involving policy in the various areas. If we can find more money, we certainly know where we want to spend it. And the human services and health and human services budget was lean. There's no question about it. And personally, I would like to see some changes in that. I would like to see some more things. The child care providers, the MFIP especially, are things that are MFIB. I mean, that I focused on. I was in favor of, felt that it was something that was necessary. So those are things we'll focus on. Beyond that, who knows? I'm not sure where things are going. As I say, this is quite a learning process for me, and I'm thoroughly enjoying it, and appreciate the input that I'm getting here, because it's important to be able to take back, fact-based, fact-specific information as we're working towards legislation. So I'm glad Pinto invited me to this. Hope you'll have me back. I haven't scared too many people. And then look forward to moving some of the programs that we've talked about here, and especially in the panel's discussions. It's been very informative for me. So I guess that's about all I can say at this point. If we get another shot at the budget, it'll be something we'll be looking at. And I can say personally, from sitting in the budget discussions in human services, some of it was painful. It really was. I mean, there were decisions made that a lot of us were not very happy with. And hopefully we can move things forward in that respect.
Thank you.
Thank you. I'm Representative Mary Kanesh-Podine. I represent the areas of Columbia Heights, St. Anthony, New Brighton, and Hilltop, and I'm really happy to be here today. I, too, am a freshman legislator. I was just elected in November, so I am trying to educate myself as best I can. I am an educator. I've been teaching for over 20 years inner city and first ring school districts. And so a lot of the information that is being shared here today really pertains to a lot of the students and the families that I've worked with over the years. I also was a recipient of a lot of these programs. I was a WIC recipient when my children were young. I was on general assistance for a while, so the amount of money that families are receiving now is the same that I received all those years ago, and I just was heartbroken when that was not amended or changed this year. But I'm really happy to be here this morning so that I can learn more about all of these great resources that are available to our families in our state. And I would appreciate those on the panel and any of you sitting in the audience sharing with me your programs that you do and the stories, just as Senator Franken's office or advocate shared with you. It's the stories that really make all of the difference, and when folks come to me and share their stories, it just empowers me and fuels me to do the work that needs to be done at the legislature. And we all know that all of these programs take a lot of money, but it also takes a lot of really good policy, and sometimes we need to go back and look at the policy that's been set in place and see what we can do to tweak that or to amend it so that the programs that are out there are going to be able to serve our families in the way that they need to. And I'm thinking of childcare providers. I also was a childcare provider for about 5 years, and so some of that that we've been discussing today really resonates strongly with me. But we have to remember at the end of the day that what's really important is building our strong families, strong schools, and strong communities. So thank you for allowing me to be here today.
Thank you. So, Dan Pollock, where is Dan? There you are. You're going to offer a comment on.
Yeah, I'm Dan Pollock. I'm Deputy Commissioner for MDH, and thank you for the event and also the great dialogue about home visiting. I wanted to preview a Gov Delivery notification we'll be doing probably by the end of the day today. If you're not on our mailing list, you can give me your contact info. I'll stick around for a couple minutes. Just laying out the timeline for the public input sessions on the home visiting expansion. That'll be an opportunity to weigh in on new evidence or new models that you'd like to see added. There's going to be about 7 different sessions, both phone-in, Metro, and we are looking still to do some Greater Minnesota ones. So if your organization's based in Greater Minnesota, there'll be an email in that notification later today to offer up to do an in-person session in a location in Greater Minnesota. So the comments that Laura made were absolutely right. We're obviously looking to build on the evidence-based models and potentially add new models that are supported by evidence. That was the decision that the legislature made, was how to build the expansion. And I think there's a lot of good reasons for that. They want to see the downstream outcomes of the spending that you saw in the presentations. And so that's the reason. But really excited for the opportunity to do this big expansion, and I think it will pay tremendous dividends for our state. So we really thank the legislators' interest and support for that.
Okay, thank you. And now, going once, twice. I think, is this it? Chicken soup with rice? Okay. I know my books. All right, people, thank you. And thanks our panel, to our speakers. We just really appreciate it. And we'll come again.
We're just, and sorry, we're not quite done, actually. We just got, it does say wrap up on your agenda. So, Senator Ralph, you go first.
I just, first of all, I want to thank you all. Thank you all for having me here. Appreciate the opportunity. One of the things just as that has come to my mind as we've been talking, and that is this workforce issue. And this is the tip of an iceberg that is floating, shall we say, up the Mississippi. We have a huge problem in workforce in Minnesota. we've been talking about jobs, 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 and one of the big problems we have is we have jobs. We're having trouble finding people to fill them. And one of the initiatives that I'm looking forward to working on, and we're talking this just as we were talking in context, on a broader spectrum, one of the things that we are going to be working on as we go forward. In fact, I'll be going to a conference this afternoon. I'm sorry, today is Tuesday. Yes, I'm in St. Paul today. Tomorrow I'll be going to a workforce conference in St. Cloud, at St. Cloud State, working on some information on trying to put together some programs. On Friday, there's another, in Maplewood, there's a workforce study group that's going to get together on, especially in the disabled area, which is one of my great concerns. I have a great deal of concern about the disability community and the, from the care provider standpoint. There's a shortage both in all of the care providers in the medical field. We have, the last time I talked to someone, one daycare provider alone, or not daycare, one medical provider alone had 300,000 hours of unfilled, qualified, funded services that they couldn't find people to provide the services for. So we have a workforce shortage, and it spills over into every area. It spills over into the daycare. It spills over into the other areas of childhood care and development, and it's something I'm very concerned about. And that input, I'm looking for input and suggestions, ways to solve this. I'm working with the technical colleges and getting people. My wife is a just now retired teacher from the technical college in St. Cloud, and trying to figure out ways to improve people going into professions that don't necessarily require them to get a 4-year college degree. And so many of the care positions that we have today, both child care and in adult care, do not require a degree. And we have to get people into them and get them started in that. So that's one of the major issues that I see. We have a working group that was formed that will be studying a very specific area of trying to take people who do have medical training in the community and elevate them to be able to do complex PCA type approach work, community and home-based services. So this is something that all ties into what I was hearing up here on the panel is the shortage. So that's something we will be addressing as we go forward in the next biennium. Thank you again very much. I appreciate all your comments.
And I just want to say a big thank you to first of all, if the members of the Elders for Infants who co-founded these events could stand, those of you who are members, if we could please just have acknowledgement of them. I'm so glad to be collaborating with them, and a big thank you to the University of St. Thomas, St. Kate's School of Social Work. Thank you, Dean Carvalho, and Professor Catherine Hills helped organize this. Thank you so much. And I just have to note that we've got a whole big group of volunteer, mostly constituents, who've helped put this together. Jessica Griffith, Dr. Krish Subramanian, hope I'm saying your name right, Krish, and a number of folks as well. And just to all of you, many thanks. And I want to make sure to acknowledge as well, in addition to Commissioner Pollack, we have Commissioner Jim Koppel from Department of Department of Human Services, pardon me, here, and Melvin Carter, who's the director of the Children's Cabinet for the state, on the back as well. And Mary Vanderwert, a member of the St. Paul School Board. I think that I've hit the elected officials as well. Anybody who's been to these events all 5 times, could you please stand if that's true of anyone other than me? There we go. Hey, Jill. Excellent. Jessica Nicola Day. All right. So a nice shifting group. We a lot of our thought here, right, is to bring together a number of coalitions, and we really got this good sense from the group up front, and to try to take a really broad perspective on this this set of issues regarding little kids. I'm really glad that CDF included, and I guess we talked about this as well, including affordable housing. We've got paid family leave and other issues that really affect families and kids. It is important that we take that really broad perspective as we think about this, because issues that affect families affect their their youngest kids the most. And in fact, Angela, I says in here, made the point to me that the younger the kid is, the more that those factors of what's going on in the family really, really make a big difference. That's true for all kids, but as the kids get younger, that get more and more important. So as our effort to try to build this shared coalition, this shared effort, we are planning to send out your name and your organization to the folks who are registered for this event. If you have some concern about that, please shoot us an email, let us know. But otherwise, we'd like to start to spread this sense that we are working on this together. Please spread the word about the next forum, which will be in October, and we're hoping to be able to announce a date pretty soon, the next couple of weeks, and we're going to keep on going quarterly after that. And especially, please spread the word statewide. You'll note that we have a webcast. We really want people from all over the state to be participating in this discussion, this dialogue, and this building of eventually a shared agenda. You may notice that each of the coalitions that presented is a coalition themselves rather than an organization. They're speaking on behalf of multiple organizations. Now we have multiple coalitions. Over time, we're building this sense of all of us pushing together for early childhood and for youngest kids. So many thanks to everybody who put this together, all of you for being here, and let's keep on keep pushing. So thank you so much. Bye-bye.